The American Civil War, a conflict that split a nation and tested its ideals, was also a crucible of medical innovation. In this documentary, we embark on a journey to explore a lesser-known aspect of this war: Civil War medicine. In a time of unprecedented bloodshed and suffering, enter the world of the battlefield medics, surgeons, and nurses who risked their lives to save countless others. The Civil War, which raged from 1861 to 1865, was a watershed moment in American history. It was a war that divided the nation along ideological and geographic lines, leading to the unimaginable loss of life. However, within the crucible of this conflict, a remarkable transformation occurred in the field of medicine. The Civil War was a brutal, devastating conflict that resulted in an unimaginable number of casualties. With soldiers engaged in close-quarters combat, the wounded often suffered grievous injuries. In this section, we delve into the harsh realities faced by those on the front lines. Amputations, a common procedure during the Civil War, were often done without anesthesia or proper antiseptic conditions, leading to immense suffering. Soldiers lay on crude operating tables, enduring unimaginable pain as surgeons swiftly removed limbs to save lives. Personal accounts from soldiers and medical personnel will vividly depict the horrors of the battlefield. Inadequate sanitary conditions in camps and on the front lines contributed to the high mortality rate among wounded soldiers. Diseases like dysentery and typhoid fever were rampant. Malnourishment and exposure were constant threats to the soldiers' well-being. To address the massive influx of wounded soldiers, field hospitals were established near battlefields. These rudimentary facilities, often little more than tents or converted buildings, played a critical role in providing immediate medical attention. We explore the challenges faced by the medical teams as they set up these makeshift hospitals and witness their tireless efforts to save lives. One of the most significant innovations in Civil War medicine was the introduction of organized ambulance services. Dr. Jonathan Letterman, the medical director of the Army of the Potomac, revolutionized medical logistics by creating ambulance corps. This innovation drastically reduced response times, leading to increased survival rates for the wounded. These early paramedics worked diligently to ensure that wounded soldiers received timely medical care and were transported safely from the battlefield to the field hospitals. Despite the grim conditions, the Civil War era witnessed remarkable advancements in medicine. Dr. William A. Hammond, the Surgeon General of the Union Army, implemented a standardized system of medical care and introduced innovative practices in surgery, hygiene, and disease prevention. Medical practices and surgical techniques, including the use of antiseptics, began to take shape during this period. These advances significantly reduced post-operative infections, which had been a major cause of mortality. Clara Barton, who later founded the American Red Cross, played a crucial role in providing care to the wounded on the battlefield. She not only cared for the injured, but also organized efforts to locate missing soldiers and notify their families. Her unwavering dedication inspired countless others to join the cause. The introduction of anesthesia, pioneered by dentist William TG Morton, was a milestone in medical care. Ether and chloroform allowed for more humane and less painful surgeries, marking a turning point in the history of surgery. We explore the impact of these substances on medical practices during the Civil War, from amputations to more complex surgical procedures. Throughout the Civil War, a cadre of unsung heroes emerged, including Mary Edwards Walker, the first female contract surgeon in the U.S. Army. Her remarkable contributions challenged traditional gender roles and blazed a trail for future generations of female medical professionals. Dorothea Dix, a nurse and advocate for mental health reform, dedicated her life to caring for the wounded and improving conditions in military hospitals. Her tireless efforts extended beyond the battlefield, as she lobbied for improved treatment of the mentally ill, leaving a lasting legacy. Sally Louisa Tompkins, a Confederate nurse, earned the distinction of being the only woman commissioned as an officer in the Confederate Army. Her hospital in Richmond, Virginia, achieved impressive survival rates among its patients, earning her the nickname Angel of the Confederacy. The crucible of the Civil War molded the field of medicine into a more efficient and compassionate force. The brutal trials of the battlefield and the unwavering dedication of medical professionals resulted in groundbreaking medical practices that continue to save lives to this day. The implementation of standardized medical care, innovations in surgery, and the introduction of anesthesia had a lasting impact on the medical profession. These changes not only improved the treatment of soldiers during the war, but also influenced the development of modern medicine. We extend our heartfelt gratitude to historians, medical experts, and descendants of Civil War medical personnel for their invaluable insights. This documentary would not have been possible without their contributions. As we delve deeper into this turbulent chapter of American history, we invite you to explore the further details and stories of Civil War medicine and the heroes who shaped it. Their dedication and innovation continue to inspire the practice of healing and stand as a testament to the resilience of the human spirit in the face of adversity.